Hello, it's Khan again. I thought it's been a long time. I have uploaded a video on YouTube, so I thought I should upload a video on YouTube. And today I'm just going to talk about ECG. So that is electrocardiography. So before starting about the electrocardiography, I want to tell you that watch this video up to the end, and there will be something for you. And I want to tell you about. So now I'll start the about ECG. So ECG is a thing. So that is that tells you about how your heart functions. Electrocardiography is a thing. So if you went to a doctor, he will prefer ECG. So if you feel if doctor feels any problem with your heart, you feel any problem with your heart, so then doctor will recommend you to go through a ECG. So now I want to tell you all about the procedure and the phenomena that is involved. So that is involved in the ECG. Okay, and what it involves and how a doctor will detect what happened to you. So I want to tell you about all about that. And now I'll start it. And ECG is a technique that stands for electrocardiography. Means it is a machine which which detects the electrical functions of your heart, and it will draw a graph graph of it would represent your electrical functions of your heart in form of a graph. That is electrocardiography, and you can see this. I have drawn a small thing. This is how it looks like. So I think some of you have seen electrocardiography. So now I will start about it. So in this diagram, you can see I draw something like a P wave, P wave, Q wave, QRS wave, and T wave, and some of intervals and some of segments I draw in this. So I'm going to tell you about all about this. Okay, and before before I start to explain about ECG, you should know about what actually happens when a heart beats. So I want to tell you. So you will have a two atria and you will have two ventricles, and in between atria and ventricles you will have a lot of walls which will prevent the entry of blood from atria to ventricles. So and so that's how it functions. So means closing of these walls will form a sound of love, and closing of semilunar walls will form a sound of dub. Okay, and now I'm going to explain you each and everything about this thing. And so what happens is when a blood enters from all parts of the body into atria, means we have a four chambers, there is two atria and two ventricles. So when blood enters into the right part, so the right part into the right atria. So when the blood enters into the atria, what will happens is the walls in the heart will open, so the blood will enters into ventricles from the atria up to 70%. So after that the atria will contract to push the blood that is remained in the heart after all the blood is passed. So the atria will contract to push away to pump the blood to the ventricles. So this contraction is called we call it as atrial systole, and thereafter we have it about uh, atrial systole. That is, the ventricles will pump the blood into the semilunar. Means it is of walls. Into the semilunar walls, aortic arches. To this, three aortic arches. From the three aortic arches, this blood is going to be entered into the all. It means into the pulmonary things, like into the lungs. Thereafter it is going to be purified, then again it's going to be come back to the atria, left atria. So then it's going to be go back to you know all the different parts and give oxygen to all the cells. Okay, this is what how our heart functions. So now I want to tell you about the heart has some pacemaker, means some kind of the thing that will produce electrical impulse, so that is why the heart will contract. Because of the impulses, the heart will contract continuously. Okay, so if you can observe that, if you remove the heart, if you remove the heart, if you so if you see in heart surgery, heart transplant, so if you remove the heart from the from one person, so then if you remove it, so then the person, that heart is going to be continue to beat, because that is because of the pacemaker that is present in the heart. So it can able to produce impulse without the nervous system. So it can able to produce a self impulse. Okay, and so that's the fun, that's all about it of heart. And we call all this stuff, entering of the blood and pumping in the atrial systole, and we have a of eight the blood enter into the atria, it's a and then they will contract, and that is atrial systole. And the ventricles, the blood enter into the ventricles, that will they will contract, and from that they enter into aortic arches, they go into lungs, and so they go into all the different body parts. So at night, when ventricles contract, and the atria and the ventricles will relax. So that is the ventricular diastole, ventricular diastole, and the atrial diastole, and the cardiac joint diastole. And then now, based on this thing, the ECG, will explain the ECG. So based on this thing, only ECG, how ECG works. Okay, how ECG works, and a doctor can diagnose a patient with some problems, all this stuff. Okay, the ECG, if you have a particularly seen this, so ECG will have a is in form of some graph like things. It has a P wave, it has a Q wave, it has a R wave, it has a S wave. We call it as Q or S complex of waves. Okay, and we have a T wave here. So this you can see here this P wave. We have a P wave here. What it indicates that it indicates the atrial contraction. Okay, it indicates atrial contraction. It lasts about 0.1 second. So it indicates the electrical impulses passing throughout the atria. So it involves that thing. And so if you see that you know that is a P wave, it lasts about 0.1 second, because the atrial systole lasts about 0.1 second. And and thereafter you have a Q or S complex of waves. I want to tell you about, if there is a change, P wave should be normal like this. P wave should be normal like this. If there is if in case there is an increase, or if there is any decrease in the P wave, so then it indicates abnormality, means it indicates some problem in the heart. So a doctor can recognize what is the problem based on these changes in the morphology, or changes in this length of the waves. So you can recognize, and based on this, increase the length of the waves, and based on these things you can diagnose what happened to you. Okay, so this P wave since this indicates that the atrial systole, so increased P wave indicates that the atria are elongated. means the atria are increased in area, means it takes some time to go all to, means take time to the impulses to to pass on all through this atria, so atria, so increase, so that increases the, that shows the increase in P wave in the electrocardiography. So then we have it of QRS complex right here. So then we talk of QRS complex and this QRS. So then it is a QRS complex. So this indicates actually ventricular system, means it just it tells about all the stuff, the electrical impulses all passing through the ventricles, and it tells about the ventricle, how it's working, all the stuff. It lasts about 0.12 second to 0.1 second, and if there is uh, there is a change in QRS complex of His, it indicates that there is a problem with bundle of His. Bundle of His is a thing that is present in the ventricles, which is responsible for the production of impulses in the ventricles. So this is responsible for the impulses in the ventricles. So it a change in the QRS will indicates that there is a problem in the bundle of His. Okay, so then again T wave, the last wave, that is T wave. It's T wave. T is what is T wave? So it indicates the ventricular repolarization. So usually ventricular repolarization or atrial repolarization occurs two times. Well, repolarization or the diastole, that is relaxation. So relaxation of atria occurs two times and relaxation of ventricles occurs two times. When atria contracts, so then the ventricles will relax, and when ventricles are contracting, the atria will relax. So um, when the blood is out, so then they both jointly relaxes, that is joint diastole, and two times of diastole and two times of diastole. So this T wave indicates the diastole or the depolarization of the ventricles when the atria are contracting. Okay, then we'll go through the intervals. So intervals are the things that are present from one wave. It's present between onset of one wave to the next wave, onset of one next wave to the next wave, like that. That are the intervals. So we have three intervals. These are PA interval and PR interval and QT interval, and one more, it is RR interval. RR interval, it's a thing we can see if it's present between one R to the next R, that is present in next line. Okay, next thing, that means RR interval indicates one cardiac cycle, means so from the starting of entering the blood into atria and then ventricles, then all to the or relaxation, indicates RR interval indicates all the cardiac systole, atrial systole, ventricle systole, and cardiac diastole. So it's the duration of this RR interval is 0.8 second, whereas this PR interval, you can see here, this PR interval, it is an interval that is present from onset of P. So this onset of P wave to the onset of Q wave, the interval that is called as PR interval. So it usually tells about the tells about this atrial, how the atria are working, how the impulse is going to be going on in the atria. So if there is a change in PR interval, so then indicates that the problem with AV node and SA node, means that means SA node and AV node are the things that are present in atria, and AV node is present in the ventricles. So SA node is present in the atria, that and AV node is present at the starting of the ventricles. So this SA node will produce impulse, and then it will pass it to the AV node of the ventricles. So if there is a change in that, if there is the impulse is too slow, so then the PR interval, the PR length, the PR length of the line will increase. Then that will increase. Okay, and the next one, that is of change. I mean, QT interval. QT interval. So for QT interval, you can see that it's QT interval. Yes, QT interval. It's a QT interval. It's an interval that is from the onset of Q wave to the T wave. Indicates the electrical impulses, in the ventricles, how it's working. If no, it changes with the heartbeat. It depends on the heartbeat. If the heartbeat is fast, then the QT will be length of the QT will be low, and if the heartbeat slows, then the QT interval will be large. That is because of because of if QT into if the ventricles contract more fast, the heart beats more faster, then the ventricles impulses will be longer, so then the QT will be will be like I will tell you again. QT, I'm sorry for that. QT interval indicates a ventricular things, ventricular electrical impulse in the ventricles, and so this depends on heartbeat. So heartbeat, if the heartbeat increases, the QT interval will be short, and heartbeat decreases, then the QT interval will be longer. And if there is any change in QT interval, if the prolonged QT interval, it indicates that the hypothyroidism, how the hypo and myocardial infarction. Hypothyroidism is a case which involves in the low levels of thyroxine hormone. It is a case which in that case the thyroxine level will be low. So what causes the low level of thyroxine is the lack of deficiency of iodine in the diet. So when there is a hypothyroidism, so what happen is, if there is a hyposecretion of that hypothyroxine hormone, then the BMR rate, so that is basic metabolic rate, not basic, it's a basal metabolism rate, will will going to be decreased. The basal metabolic rate, it's that means it, if basal metabolic rate is a thing in which this thyroxine will the will increase the metabolism rate, means that will increase the utilization of oxygen, and that will increase the production of ATP, so that we have we can have so much of energy. So what happens if there is a hypothyroxine, means low level of thyroxine, means the thyroxine will actually stimulates the heart to to secrete, to pump the blood faster, so that we can have more oxygen. If there is a low level of thyroxine, then the level of oxygen in the blood will be low. The thyroxine will not stimulate the heart to pump the blood for faster, so then eventually we don't have that much oxygen to produce ATP. So that's this indicates the the QT interval, the length of the QT interval low, means that hypothyroidism. It eventually indicates a hypothyroidism. And one more thing is myocardial infarction. It means necrosis of the myocardium. That is a layer of the uh, heart. That is a middle layer. Heart consists of three layers. Okay, the middle layer is myocardium. Okay, what happens is in the myocardial infarction is actually the necrosis of it. Necrosis means death of this myocardium tissue will happen in this case. So this indicates the QT interval will be small. Okay, long QT means small QT means it indicates that hypercalcemia. That means increase in the calcium levels. So due to the function, more function, due to more calcium levels in the blood, it means the muscles will contract faster and faster. The heartbeat will be so fast, the muscles of the heart will contract so faster that uh, so faster that the QT interval will be small. And we have a tough RR interval that I already told you about. It's between in between the one cardiac cycle to the other cardiac cycle. So if there is a change in that, it indicates that obviously the heart functioning is abnormal thing. And we have two segments. I will show you. Uh, One segment is PR segment. Here you can see it's PR segment, and one more thing, that is QR segment. QR segment. Q no QT segment. Okay, sorry for that. QT segment and PR segment. So PR segment, that's that's present between ending of P to the starting of Q wave, and ST segment, it's ending of S wave to the starting of T wave, and ending of a T wave. Okay, and if there is a change in ST wave, it indicates that myocardial infarction, that is the death of the tissue. Okay, and finally T wave. T wave, if there is a rise, that's a T wave. Okay, T wave indicates the ventricular repolarization. If there is a change, if the is it taller, if the T wave is tall, so then it is called as hypokalemia. Hypokalemia means the electrolytes of the potassium electrolytes in the blood are more. Shortening means shortening of the T wave indicates that it is hypokalemia. That means the electrolytes of potassium are low. So I told you this is all about ECG. I told you that at the first I will have something for you. Have you heard about the word epigenetics? What it is? So if you want to know about epigenetics, what is it, and what it involves, what happens, it is a thing. So that explains you about, it's a thing that is different from genetics. uh, it it is different from genetics. You can know about more about epigenetics in my next video. Just please subscribe to my channel, and see you next in that video. Bye bye.